So moving on to today's agenda for the webinar will be approximately an hour, covering the wider context of why we've done what we've done with the passport, the introduction and implementation of the passport, and a brief overview of the respiratory surge in children, and any questions we'll take at the end. Like I said, we've got 15 minutes allocated for questions. So as an introduction, background, wider context of why we've come up with the passport. I'm Carly Whitaker. I'm currently the president-elect for the Paediatric Critical Care Society. I'm Director of Clinical Skills for the University of Nottingham, and I'm a sister on PICU. And in collaboration in June 2021, the Critical Care Society, the Paediatric Critical Care Operational Delivery Network, and the London Transformational Learning Collaborative, the LTLC, were asked and commissioned to come up with the Respiratory Surge in Children programme. And as part of this programme, the ambition was to create a digital skills passport to support the staff and understand and document the skills and necessary education essential for roles of people coming to critical care to support us in any surge to increase capacity. Historically, there's been some national work undertaken by the Paediatric Critical Care Educators subgroup, both at level 1 and 2 and level 3, to come up with some national competencies that were transferable between units. This is currently being piloted in some level 3 centres, but with the long-term ambition to have these digitalised. With the LTLC previously developing and rolling out the National Adult Critical Care Skills Passport, we were in the right position to develop this further from a paediatric perspective. So from a wider context, we learned that we need to increase capacity every winter, not just for this, although we did it for RSV, this surge, predominantly we surge every winter. So it's about how we increase our capacity safely and efficiently, and as well as building our core staff. And if staff are required to work outside of their skill set, out of their expertise, it's about knowing what they need to do to upskill safely. And as I said previously, digitalising everything is the way forward, and it's certainly something that we're aiming to do from a PIC community perspective. Some benefits of the passports can be classified into staff. So just knowing what you have to learn and mapping that for revalidation purposes, visibility for staff of knowing what they need to complete and why, and not moving outside of their boundaries. But also from a trust and systemic perspective, it's knowing what your employees and what your staff are doing and how we can support those going forward. It's visibility, live visibility, and knowing what our staff are working towards and where our gaps are from an educational perspective and where investment needs to be from a trust and system perspective. So I'm going to be brief. So moving on to the introduction of passports.
Thanks, Carly. Hi, everyone. I'm Stacey Bedford. I'm the clinical lead for the Paediatric Digital Skills Passports at LTLC. And I just want to run through the approach that was taken in development of the passports. So this is a very rapid progression, and essentially a group was formed from the stakeholders, which involved representation from PICS educators, from paediatric educators, from adult educators, predominantly educators, but representation from people that have an interest in the surge management and in also introduction of passports. So essentially the questions that were asked of this group was to figure out what is our priority and how are we going to help and who are we going to help, essentially. So just thinking about it from a rotation of staff perspective, as to staff moving to different areas, perhaps into PIC, but also about where our sick children might end up. So they might end up in adult critical care if they're over 12, perhaps. Or we might end up with adult critical care staff supporting us, for instance, or children may end up staying in a district general hospital ED for longer. So from those perspectives, we then created the passport. So as Carly's already alluded to, we were lucky enough to already have a piece of work on the go, which was the foundations of Paediatric Critical Care Passport. So from this list of competencies and skills, we took a short list, which was a much more sort of a shortened approach, because we're looking at a surge model. We're not looking at the depth of knowledge and understanding that we would normally want in our staff. We're looking at a surge model, and therefore a much quicker and succinct set of skills that can keep children safe. So moving on from that, we created these shortlists for our 4 passports, and then we encouraged feedback from all the groups that we'd initially involved in the first place. So we got feedback from the PICS educators groups, level 1, 2 and 3, from a network approach, and from retrieval services, particularly for stabilisation of children passport. So then once we've done that, we then mapped the e-learning resources. So a huge amount of work had already gone into the Respiratory Surge in Children programme. And from that work and the work that's ongoing with that, we have a full mapping of resources. So the most relevant resources to the skills involved in these passports were then mapped so that you can easily link to resources to be able to close the gaps that you've recognised within your self-assessment. And thank you very much to Carly and colleagues, because at this point then we received endorsement from the Paediatric Critical Care Society, and this is very much a joint venture with them, and we're really, really grateful to have had their support in this process and beyond that. So ongoing, the work that we're doing at the moment is looking at improving the functionality, and also the e-learning and the mapping and resources from the Respiratory Surge in Children programme is building all the time. So making sure that we're continually mapping to that, recognising any gaps that we do have in that and building on that. And also making sure that we have the toolkit for implementation locally to make that as easy as possible, and to build the educator resources, educator bundles that will make that implementation and improvement of skills and knowledge easy to implement. So moving on to, from a user perspective, what are the steps that you'll take when you undertake these passports? So firstly, you'll register for an account, which we'll show you in a minute as we run through the live demo. Then you'll discuss with your manager or your supervisor as to what's the most relevant passport for the skills that you're going to need. So once you've done that, you'll run through those skills and you'll do a self-assessment to see what your ability is currently. And then that will link you to understand where your gaps are. And then you can access directly the links on the Respiratory Surge programme to be able to support yourself in building those skills. Once you've done that, you'll then get your supervisor to go with you to the sign-off stage, and they'll run through and decide where they feel that you are at in comparison to your self-assessment. Once you've completed that stage, you'll get the final supervisor assessment. And at this point, when you've got 100% completion for the passport, then you can gain the certification for it. And then that can be sent to your managers. And we can also have a manager overview in that. So we'll move on now to the live demo of the passports. So if you don't have an account already, then you need to move to the sign up part of the web page. If you're just going on for a look, then you can put in your details and you can register yourself as in a test region and a test site if you're just going for a look and you don't intend to actually use the passports yourself. But if you do intend to use the passports, then you obviously put your details in of the region and the site that you're working on. So once you have your login set up and you move to the login page, just a quick mention that on this landing page before you log in, it's in relation, this is the landing page and the sign-in page for the adult and the paediatric digital skills passports. So the videos that are there currently are relevant, but they're mostly relevant for the adult critical care passports, and we will be updating those at some point in the near future. So as we go in, the landing page that you'll see is if you have started any passports at this point, then they will be there on your first page. So you'll be able to quickly access passports you've already begun. If you haven't started any passports, then along the top ribbon, you can see that there's a passport tab there. So we'll go into that passport tab. And then under here, we have the adult critical care passports, which a lot of people are familiar with now. And then we have the pediatric passports. Now, at this point, let's just run through what those passports are, because we haven't mentioned that yet. So the 4 passports that we came up with are the adult critical care nurse caring for children under 12. And that's focused very much on the differences between caring for children and caring for adults. We then have the adult critical care nurse caring for 12 plus. And really, this is focused on almost like a confidence boost to be able to focusing on what the similarities are. So it's a much shorter passport and really ensures that people feel more confident in the fact that they understand what the major differences are between a 12-year-old and an adult, but they can transfer those skills and they have a lot of transferable skills. We then have the registered children's nurse without recent experience and or formal training in paediatric critical care. A bit of a mouthful. But this is essentially, there's two ways in which this can be used, probably more than two, in fact, but the two main ways would be anybody that's expected or has done in the past moved from a paediatric ward area into a paediatric critical care area, and to provide them with the skills that you may need to feel confident working in a surge model within that critical care environment. The other way it can be used is actually that passport is, there is a code within it which highlights those skills which are suitable for level 1, 2 and 3, and skills that are appropriate for level 1 and 2. So although you can't certificate at level 1 and 2, you can go on and complete the passport to level 1 and 2 if you're in a centre where you wouldn't be expected to be caring for children that are ventilated. And then we have the stabilisation of children under 12. So this is really focused on a much more succinct set of skills for when we have, for instance, delayed retrievals in district general hospitals, and we're expected to care for children that are deteriorating for a little bit longer, but not necessarily working a 12-hour shift caring for a critically ill child. So once we've selected the correct passport for us, we'll go into Start Passport. So that will activate the passport, and then you'll see that that changes to, you've got a status when you started, and we'll click on View Passport. So as we go into the passport, you can see that you have at the top, you have that detailed explanation still as to what kind of people this may be suitable for. And there for this passport, and it's the only one that has this code, it has that coding there with the yellow stars and the blue stars as to which skills are appropriate to all children and which skills are just appropriate to level 3, and that's predominantly invasively ventilated children. When we go down the list, you can see that you've got what we call domains, but they're essentially topic areas or subject areas, and it allows you to go into each section and it feels like an achievable bunch of skills essentially. So we'll click on that first domain or subject area, and you can go into the self-assessment area. So as you go into self-assessment, you'll then see as we scroll down that you'll start to see the skills. Now, these skills, as we say, are built from the foundation competencies for paediatric critical care and for anybody from qualifications. So this is not just sort of advanced skills. So they're written in a way that is those that are predominantly clinically based skills. So you can see somebody do it and you can sign them off, either actually in practice or as a simulated experience. And there are those that are knowledge, so based on the theoretical underpinning knowledge behind that. And there are those that are knowledge application, and that's really about it's not just good enough to be able to know how to do a skill and know what the theory is behind the skill, but doing it at the right time and the right place for the right child. So what you'll see is that within this, there are less knowledge and knowledge application skills and more focused on clinical skills. And that's because we're looking at a surge model of care rather than having that full underpinning knowledge. But there are some areas in there that do cover that knowledge aspect. So we're in self-assessment. So I would go through here and I would click those that I feel I'm capable of doing. And I'd complete that in this section. And then when I'm completed, I'd go down to the bottom and press Save and Next. So once I've gone into, once I've done my self-assessment, I can then go back to the domains list again. And then you can see that it instantly updates to tell me which parts I've completed. So I've got an instant update there that I've gone in and I've self-assessed that part of it. Once my supervisor is ready, I can go to start the review with them. So once we click on Start Review, we then put our supervisor's information in, which they should provide you with, including their NMC number. So when they go into that, they have the same domain or topic list, and they can choose to either select all within that list, within that subsection, and if they're happy with that, I can achieve all of those skills, or they can go in individually and select each skill individually if there's some areas that they're unsure of that I've achieved as yet. So once they've chosen those, they'll again go down to Save, Review and Next. So once we've done that, we can see that that has also been updated straight away. And if we move into our passport dashboard, we can see within here that we can then link to this tells us where we go if we want to map to the e-learning resources and the resources available to be able to close those gaps of knowledge that we recognise. So within that, we have those useful, really quick links to those skills, that those resources that have been linked through the Respiratory Surge programme. And it also tells you how long they take, so that if you've got a set amount of time, you can choose resources that will fit with the time period that you have available to you and click straight onto those. So that's a really useful part of this programme. If we also go to the sign off page here, and then that moves us into a dashboard page. So here you can see your progress. So you can see there's a progress bar that shows me I've done 6% of this passport. And the green areas within those domains show me that these are areas that I have self-assessed and have been signed off by my supervisor. And the red areas are those that are yet to be signed off by my supervisor. So it's a useful overview, a heat map of my progress so far. So once that is fully completed at 100%, I'll be able to click on to gain my certificate, and that will take me to a certificate page where I can download that certificate, and I have evidence there for my manager. The other part to show you in the passport page is that you do also have the ability to do CPD log across the top bars, and you have the reflections that you can do there as well, which can go towards your NMC revalidation. There will also be a reassessment process. So if a year on down the line you feel like you need to be reassessed, or your trust feels like that you should be reassessed at these skills, that process will be available to you also. And that's the live demo of our passport. So just moving back onto our slides. So just to give it some examples, or so that it's really tangible in how we actually will use these passports. We've just run through some working examples, and these are just 4 of the examples that that I've come up with that may mean that these paediatric passports are useful in practice. So one example is thinking about staff turnover in a busy paediatric ED, and I think we're all very aware of the reality of the fact that through burnout, through the stresses and strains of nursing in the last few years, there are a lot of areas in practice that are experiencing big turnover in staff. So if you picture a busy ED and you picture somebody trying to roster for in the coming few months where they're seeing a shortfall in their skills mix, if they were to implement the stabilisation of children passport at this stage, they could it give them a period of time where they can look at their recruitment, look at their training processes, and try to improve their staffing. But in that period of time, they could support their team to gain the skills and knowledge they need to be able to safely stabilise children and be able to cover the resus bay area of their ED roster. And it would allow them to roster with those skills in mind for a shortened period of time. Example 2 would be in an adult critical care unit in a district general hospital. If they've experienced in the last few months delays in paediatric critical care retrieval processes, then and they felt sort of that they weren't well prepared for that, then they can access the adult critical care nurse under 12s or the over 12s or both passports, and use those to increase their skills in the next year or so that they're ready for the next surge in respiratory illness for children, or any future problems in staffing and workforce or delayed retrieval times. So it allow them to feel more prepared next time rather than out of their depth. Third example is an adult critical care centre in a tertiary where surge planning has alluded to the fact that they may need to care for children of 12 plus. And really, that's, as I said before, that is a shortened passport. So it means that it's a very tangible list of skills that they can complete. And by doing that, the oversight for the trust will be that they can see what percentage of their adult critical care nurses are able to care for those children, so they know how ready they would be for a paediatric surge. And then lastly, the paediatric nursing team supporting PIC team in Surge. So this may be that you've had a paediatric team that have been supporting their paediatric critical care unit in the last few months. They've gained skills and knowledge that that would be usable in future Surge and usable in the care that they're delivering now, and they want to recognise those skills that they've gained. So they can go on to the RN Child passport and complete those skills and recognise any gaps, and go on to have a self-assessment, a sign-off assessment done by their supervisor, so that they feel more ready to be able to support the transfer of their skills into PIC in future Surges. So just a few of the examples as to how these passports are tangible. And now we're going to move into the implementation phase.
Thanks, Stacey. So hi, my name is Ellen Artall and I am the strategy and implementation lead for the passports. And as Stacey mentioned, I'm going to go into a bit more detail about implementing the passports. So firstly, just to say, since launching end of December last year, we're delighted that 130 people have accessed the passports so far. As you can see in the table on the left, the registered children's nurse and the stabilisation of children passports are the two that have been accessed the most. And what's also great on the right, hopefully you can see, is that the passports are being accessed across the country, which is exactly what we want. So a few key points around accessing the passports, and these are based on questions we've received to date. So firstly, the passports are available on their own website, as Stacey just showed, and you can also access that website using the QR code to the right. There also, the link to the passports is available on the Respiratory Surge in Children programme page, which Libby Thomas is going to showcase you shortly. And some key points about the passports: they are free to use and they're available now. They are accessible to staff at any trust across the UK. And if when you go to sign up for the passports, you can't see your trust in the drop-down list, please just send us an email and we will happily add it. It's also up to staff members and trusts whether they want to use these passports. They are not mandatory in any way. And the passports don't need to be hosted locally, so they are not hosted on individual trusts or organisations' systems. What this does mean is that passport completion cannot automatically be recorded on your trust's ESR or eRoster databases. But how other trusts have overcome this is they've been inputting a skill that basically is titles aligned to the passports onto their eRoster system, so they can use the information around passport completion to inform rostering of staff and workforce planning. If you are a trust that would like to implement the passports, we can give you admin functionality. So what this allows you to see is which staff are accessing the passports in your trust and also what stage of passport completion they are at. And you can see this in three different ways. So firstly, you can see high-level pie charts that show for each of the passports what number of staff are at the different stages of passport completion. You can also download a more detailed Excel export, which provides a bit more detail. And you also have the option when you download this to anonymize the data, so anonymize the names in case. And then if you want to see at one level of depth further, so actually at the individual skills level, similar to what Stacey showed in the demo, you can see each staff's heat map of completion. So you can see which skills they've self-assessed yet, or they've been reviewed, and you can also see that total progress bar. We've developed a number of materials to support staff using the passports and also implementing the passports. And we're also developing additional ones, which I'll show in a second. And just where these are located, so if you go onto the Digital Skills Passport website, on this Need Help ? tab, there are a number of materials that can help you, and you can access these materials both on the login page, so before you've actually even created an account, but also once you're logged in as well. For using the passport, we've got a frequently asked questions document that's compiled question and answers to all of those we've received so far, and we'll continue to build on this as new questions arrive. So that's a good initial starting point if you have any questions, both about using and implementing the passports. We've also got a general user guide. So it's a step-by-step how-to. It starts right at the beginning of registering an account all the way up to how to get your certificate. And as Stacey also mentioned, we're in the process of updating our how to use the passports video guide. So this would be a video version of the step-by-step how to use it. From an implementation perspective, we've created a toolkit for implementation. So this helps trusts to understand how they can follow a quality improvement plan, do, study, act approach to implementing the passports, and some key things to consider in that plan phase to make sure your implementation is as efficient and successful as possible. There's also a A4 poster or leaflet that could be used to raise awareness of the passports. It's fully editable, so you can add your trust logo on, you can adapt the wording and messaging depending how you're planning to use the passports. And there's a overview presentation that you could either attach in an email or you could actually present, that is to provide a high-level summary of the passports for staff, how they were developed, why they were developed, and what exists within them. Similar to the general user guide, there's an admin user guide. So if you as a trust do want that admin functionality, this will tell you again, step by step, how you can go about using it and getting the most from it. And we're in the process of developing some educator bundles. So these would be aligned to the passports, and also there would be considerations made to the time and resources you have available at the trust. And these would include things such as slides for face-to-face training, emerging scenarios to facilitate in situ training, and e-learning and pre-recorded options. We're also in the process of compiling some case studies for trusts that have implemented the adult critical care passports. So the adult critical care passports were launched roughly in January 2021. So they've had a year of implementation. So these case studies overview what they've done, how they've done it, and their key learning. And whilst these are obviously the adult critical care passports, a lot of the how they did it and learning is very relevant for implementing the paediatric passports as well. So please go and have a look at the materials available already, and also keep an eye out for these new materials that we are developing.
Good afternoon, everybody. My name is Libby Thomas. I am the Education Lead for the London Transformation and Learning Collaborative, and really proud to be part of this programme and supporting the work of the passports through the work we've done through the education programme. Hopefully many of you have already accessed the Respiratory Surge in Children programme, which is hosted on e-learning for healthcare. And this links directly with a lot of the work that's happening on the passports, but just to give you a little reminder about what's available on that and how you can find various links, I was just going to give you a quick walkthrough and demonstration. So the Respiratory Surge in Children programme, it has a programme page, which is hosted by e-learning for healthcare, and then the back end to that is the hub, where you can then access all the information, and it's all in separate files and very accessible. The programme has constantly been iterated and improved, so you may have visited it back last year. It's worth going back and having a look again, because things are changing and we're constantly adding more content. So 54 resources were added in the last couple of weeks, which is exciting, and we're trying to refine and improve what we're showing the whole time as well. Things that haven't changed, still tells you about the programme. There's still an area on programme updates and our previous national webinar on that. And there's directions here on how to use the programme. What's key is if you've got people who are accessing the passport, haven't been part of the programme, there's this element on how to access. We'll also tell people how to enrol with e-learning for healthcare if this is something they haven't done before. The other thing you might want to encourage people to do is to update their details on e-learning for healthcare, because if they've moved trusts, moved jobs, moved up in the world, all those sorts of things, then actually it doesn't automatically update unless people update them themselves. But they will be able to keep a record of what they've accessed through e-learning for healthcare hub, and it's open and accessible to anybody, regardless of if they don't need to have an NHS or an ac.uk email address. Anybody can sign up for access to our Respiratory Surge programme, and that's been a key bit for us about making it as accessible as possible. Just as I scroll down to let you know, if you hadn't seen it previously, we've now got our wonderful searchable index that's up and running, and this will be helpful for those doing the education who are part of Stacey's following her programme, and about how you implement the passports and suddenly need an additional resource, want to sign people to added learning. You know, sometimes you don't have time within your session to actually point things out or to go through everything, or people need a recap. And so actually the searchable index will really allow people to quickly access further materials to reinforce what may have been discussed in something else. And that's really useful. If you grab your phone, you can scan the QR code, you can share it with people, and people can add it as an app to their phone as well. So they've got those resources once they've done their passport, but they're still not 100% confident if they want to re-go back and access things again, they can do it through that. We have still got lots of other information in there in our overarching resources, lots of webinars, lots of toolkits, and our learning domains remain pretty much the same. Respiratory support's been changed, so now this is actually done as a sort of much more intuitive. It's about whether it's CPAP, BiPAP, high velocity oxygen therapy, tracheostomy for LTV. So we've tried to make this more intuitive, and we're gradually working within each of our hub folders in order to improve access to it. What we do have down here is the link to the Paediatric Skills Digital Passport, and that's got all these purple are direct links that will take people through. So you click that, open in a new tab, and it will take people straight through to their skills pass, and that's when they'll be able to either register for a new account, or I'll be able to sign back in, because obviously I've got an account already, and they'll be able to access it from there. Underneath, there's a little bit of information about 4 passport types, and what we'll do is think about any other information we need to add on this program page, but obviously the passport team have their own sites and their own information points as well. Just to let you all know, we've got a new, you may not have seen it previously, we've got an educator resources section on here, and this has got lots of content for educators to support them. And again, we're going to be working and building on that and working with the passport team to make things as easy as possible for people who are stretched, you know, haven't got a lot of time. We know you want to implement these, but we don't want you to be reinventing the wheel, rewriting new presentations and things. And that's why Stacey and Ella and the team are trying to create as much content as well. But other things, we also have things in here. We have some presentations, we have some resources on communication that you might not have found before, or on human factors, things creating your own digital and remote teaching skills, so on and so forth. And the final thing is that we have Stacey will be creating the educator bundles, and we will be hosting those on the programme here as well as in other places. So currently we have rapid access resource lists, which are just for quick access for people in different situations to get a sort of flavour of what's on the e-learning for healthcare hub, but we'll be obviously adding the educator resources in there. Thank you very much. Back to you, Ella.
Thanks, Libby. So I'll hand over to Lydia.
Great, thanks Ella, and thanks to the rest of the team. My name's Lydia Lofton. I work as Governance and Implementation Lead with the London Transformation and Learning Collaborative. And the next part of this webinar is really just to go through the next steps for you. So most of this will have been said in the previous session, but we're quite aware of the fact that there's been a lot of information presented. So we really do want to give you these points just to remind you of what you can do next, or how you can get more information where it's relevant. So just to clarify that one of the important next steps is around developing outstanding resources that have been mentioned to support implementation for you locally. So these will include educator bundles, how to use the passports, a video, and then some case studies of implementation of the paediatric passports locally. We'll also continue to link to new e-learning resources as they become available. So we've identified where there are gaps, and as these resources become available, then they will be linked to the Respiratory Surge in Children program directly from the passports. We'll also continue to collect feedback from those using the passport and also trusts that are implementing the passports. And specifically, this will be really about improving the user experience. So if you actually have some specific feedback as a user that you've already found, then right now, please email ltlc@hee.nhs.uk, and we'll put that in the chat for you. There will be an online feedback form, but that's still in development right now. So do look for that, and it should be quite easy for you to access whenever you go onto the passport page. But right now, just email us to let us know. Also, if you're an implementing trust, we're really looking actively for feedback. So please email the LTLC if you're willing to share your experience of implementing locally. So the passports don't mean anything if we don't know that the right people are able to access them and use them. So please help us continue to raise awareness of these passports. We are going to be attending different events, both regionally and nationally, in order to support awareness and raise awareness of the passports. If you have any forums that you're aware of that you would like someone from the team to attend or to speak at, then please do get in touch via the LTLC inbox address, as we've mentioned previously. We'll be delighted to do that. There will be a drop-in session that's going to be held on the 2nd of February from 1 to 2 p.m. This is specifically to answer any additional questions that you may have about the pediatric passports. We found with implementation of the adult critical care passports that these drop-in sessions have been really well received. You don't have to stay for the whole time. You can come and just listen, or you can come and ask questions yourself. So it can be very much about your needs. It's not actually, there's not a formal agenda. It is really to come and seek additional sort of input, support, learning from others. So please do email the LTLC if you would like a diary invitation and a Teams link for that session that will be held on the 2nd of February from 1 to 2 p.m. Additionally, the recording of this webinar will be shared with you, or a link to it will be shared with you via email after this meeting. We anticipate that will be by Friday this week, and it will also be made available on the Respiratory Surge and Children Program page, so you can always go back to it if you're working to introduce the passport to some of your team, or you need to refresh from the sort of helpful session there. Stacey walked through the different aspects of the passport. Hopefully all of this information is easy to remember, but if it's not, just email us at any time. We can recap whatever you need. I think that now takes us into the question and answer session. So we'll just move into the question and answer session, and I will refer the questions to people that I think are going to be the best people in the team to answer some of those questions. So the first one is a really popular question, I'd say, because it's something we hear a lot, is asking about an overview. Can you get an overview of all the staff that have completed so that I can roster knowing those skills? The short answer to that is yes, you can. And I'm going to hand over to Ella, who can give us a little bit more info on how you get access to that as an administrator.
Thanks, Lydia. Yes, you totally can, as Lydia says. In that Excel export, you will be able to see those information. All you need to do is email the LTLC, and we can set you up with admin access, and that will provide you with the functionality to be able to export that data. So it's very quick and simple.
That's great. Thanks very much, Ella. Another part of that question that's also related is who can see an overview of the staff who've completed the passport. How do they do that? So just to reiterate, the only people who can see an overview of who the staff are that have completed are the named administrators for that organization, and you need to have administrator access in order to do that. Just looking at the next question. So, is there a steer on who can act as a supervisor and can sign off as a professional in the passport? So I'm going to ask whether Stacey would like to answer that question.
It's a very, very good question. I think the the answer I would say is that this will need to come with a question of local implementation. I could give you a steer on how I would take each one, but because the passports are so different and they can be used in different places for different reasons, I don't think it's something that we can give clear guidance on. It also is down to the amount of resource and skills and senior staff that you have available to you and the partnerships you have between your adult critical care team and your paediatric team. There's a number of things at play, which is why I think it needs to be something that's assessed as part of your implementation.
Thank you, Stacey. That's also one of those questions we hear a lot, and it's a difficult one. It's not one that has a black and white answer. So thank you very much for that response. The next question is about students. So can students access the passport, or is an NMC number essential, please? I'll start by answering, and then I will also hand over to Stacey for this one. So the skills in the passport absolutely are relevant for students, especially those going into paediatric care. But the passports are designed for those with professional registration. In the pediatric passports are designed in that way, but that doesn't mean that people can't access them. Stacey, I'm not sure if that's a question that you've covered previously in other forums and how you'd like to clarify that.
No, it hasn't come up before, actually, Lydia. I know that there's definitely some interest, particularly in the respiratory surge and children information side of this rather than the actual passports. I'll have to go to Ella actually to just check if they can get past the NMC need.
Yeah, they can. Yeah, students can definitely sign up. Actually, it's listed as the roles when you do sign up, so you can select that. You don't need your NMC. The NMC is only required for supervisors signing off people.
Great, that's fantastic. Just a further clarifying question that would help maybe on that one. When students register and it asks for their organization when they're signing up for a passport, do we have any guidance on whether they need to put a specific organization related to their placement or what we would suggest that they do?
So they can actually select, there is universities listed as well. When you select the student roles, you will get the option for a university. I think it's whoever you need to have that visibility. So if you are planning to perform a role in a trust, you would probably put that trust, but at any point as an individual or also the admin users can change your place of work. So that can be changed as you move or change as well.
Fantastic. Thank you so much. The next question is also one that we've heard around the adult passports, is whether it links to ESR. I'm going to hand that question to Julie to answer.
Thank you, Lydia. Currently, this passport doesn't link to ESR, and because this is a surge passport for winter pressures, we're not going to be moving down that path for development. But as Carly mentioned at the beginning of the presentation today, webinar, we are looking at the development of those PICS competencies, and that would be looking to connecting to ESR for your business as usual type competencies. What we would recommend is that if a skill has been attained, if someone has completed the passport, that you can actually add that skill onto eRoster, so that when you're doing your rostering, you can see those that have got all of the competencies and completed, and therefore you feel are safe to practice within a role that is aligned to those competencies, and you are able then to roster effectively.
Great, thank you, Julie. Our next question is whether a registered children's nurse has to be the supervisor, or is an adult educator able to do the role? So I'm going to ask either Carly or Stacey to answer that for us.
I can start, Carly. You can chip in if you've got anything to add. So I'm assuming this is in relation to the passports that are adult critical care nurses caring for children. And I would say it depends on the circumstance. As I said earlier, it does depend on the sort of availability you have of the resources and the mentors and supervisors. But I would say it probably depends on the individual. So we know that there are people out there with skills in and and experience in paediatrics and adults. And if you happen to be one of those people, then I think you'll be a perfect supervisor for supporting people through the process of gaining those skills. So I think it really depends on the individual, on what your self-assessment is of yourself, and whether you feel you are competent and skilled to be able to sign people off in that. If not, I would say that it's really important, as I said before, to build up those partnerships between the adult and paediatric teams to ensure that we're using each other as a resource to be able to fill those gaps in knowledge. Anything to add, Carly?
No, I agree.
Great, thank you both. The last question that's been entered is whether is there a limit on the number of admin users there can be per trust? I will let Ella answer that. I don't think we have a firm limit, although we'd recommend that there is a lot of sort of careful governance around who the admin users are. But I'll let Ella complete that answer.
Yes, exactly. As you said, Lydia, there is no limitation. I think it's better often to have more than one, just in case that person is off. But as Lydia did say, they will have visibility of people's names, people's email addresses. So there is the GDPR compliance aspect to consider with selecting your admin users.
Thank you. I see another question's come up, and that is about data and information governance guidance. So we do have some basic information governance and data guidance, and the bottom line on that is that each trust is responsible for covering this and protecting the data that you will be seeing as a trust about your workforce within your own data protection and information governance policies. So it is really important that those who are working as administrators are up to date on their information governance training and are aware of policies and procedures in their trust. From a standpoint of the data protection processes that are in place from the provider of the skills passport, so from the online service, they are quite rigorous, and we do have information on that we can provide for your local information governance teams or data protection teams if they require that in order to do their own impact assessment locally.
And just to add to that, the information Lydia mentioned is if you go to that need help ? Tab on the Digital Skills Passport website, it is there, the information about the external provider, if you wish to provide it to your trust.
That's great. Thanks very much, Ella. So that's great. There were some really good questions, really practical ones, which I appreciate, because I think those are often the things that really limit people in making those decisions whether to proceed. So thank you all for so many of you for adding your personal details about who you are and where you work into the chat. I've been able to see a few of them. I haven't seen them all, but I can see that there is a really wide sort of spread of people from across the country, which is great to see. We're really happy that the word got out about this session, and please do spread the word amongst colleagues. If you want them to see the webinar, as we said before, we'll be sending out the link to the recording, and it will be hosted on the webpage, so you can share that with others afterwards. We really do appreciate your time. We know that you're all really, really busy, and we're really grateful that you came today. We hope that we're able to introduce you to the passports in a way that helps you see whether they'll be useful for you in your practice. And if you have any questions about this, please don't hesitate to get in touch with us. You can always reach us through the LTLC email address, which is on the screen there now. And we hope that you'll be able to use the passport. So thank you all for everyone for attending, and have a fantastic afternoon.